Welcome everybody. We're just admitting people as they're joining. Thank you for all of those who are here so promptly. We'll just give another minute just while we let everybody into the meeting room. Okay, I think we'll get going. So thank you. Welcome everybody. Thank you for joining us this afternoon to hear more about our Insight programme for South London. I'm really pleased that you've taken the time to join us. So the webinar today is for an hour. We're going to be talking to you about the Insight programme for South London and very specifically the scholarships that we have just opened to fund Research Masters programme to start in September, October of this year. So if we can go on to the next slide, I'm just going to do some introductions. So my name's Catherine Evans. I am a clinical academic nurse. I'm a professor of palliative care at King's College London. And I'm a Deputy Director of the King's Clinical Academic Training Office. So I co-lead the Insight programme with Adele. I'm just going to hand over to Adele to introduce herself.
Thank you, Catherine, and good afternoon, everyone. We are delighted to have so many of you here this afternoon. My name is Adele Stewart-Lord. As Catherine said, I'm a professor in health workforce at London South Bank University, but also I'm a radiographer of background. So I'm really keen to share all the insight information with you this afternoon. Thank you, Catherine.
Thank you. And then just while we're here, we just wanted to give a wave to other members of our team that when you email us, that they might well respond to you and you might also meet them. So we have Tina, who is from London South Bank University, who's not with us today. And then we have Jana Comfort, who is here, who can give a wave. So Jana is the network assistant at King's College London. Tina is the assistant at London South Bank University. And then we also have Sam Irving, who's joined us as well, who's one of our associate directors at the King's Clinical Academic Training Office. So Sam can give a wave. So Sam in particular supports our professions allied to healthcare. So we just wanted to give an introduction to have some sense of who we are as a team. Next slide, please. So what we're going to be doing in this webinar, we just want to very briefly introduce, well, what is the NIHR Insight programme? And then we're going to give some details about the scholarships for Research Masters, including some information about eligibility, and then how to apply, and then also showcasing the Masters programmes that are available to be funded by the Insight scholarships. And then finally, just to give a little bit of a teaser, if you like, of some of the engagement activities that we have running this year for the South London Insight programme. And then finally, we want to make sure that we've got time for some Q&A at the end. So thank you to everybody who has already submitted questions to us when they registered. That was hugely helpful for Adele and I to see. We will respond to some of those if we have time during the webinar, but please also, as we move through, do put questions in the Q&A. We'll ensure that we do answer all of the questions via email. We'll probably compile the questions and then our responses as a frequently asked questions so that people have all the information that they need. Next slide, please. So firstly, just to give a very brief update as to what are the NIHR Insight programmes. So NIHR stands for the National Institute for Health and Care Research. So this is probably one of the largest funders of health and care research in England. So they have had huge investment really over the last couple of years in building research capacity in underrepresented groups. So they invested an additional £30 million back in 2023 annually. And part of that investment was the Insight regional programmes. And the name is in the title, so they're regional. So there's 12, there's one in each region of the country. This is the one from South London. The QR code on the right-hand side takes you to the national Insight web pages. That gives the details of all the regional programmes. So if you've joined us today and you're not working in South London, or you're not living in South London, or you're not studying in South London, then do have a look at the NIHR Insight webpage to see where your Insight region program has been hosted and who to contact to find out more. And the intention is very much about attracting more nurses, midwives, professions allied to healthcare and other registered health professionals, public health and social care, to be pursuing research, and very much with the intention of pursuing research early in people's careers, so in their final year as an undergraduate, for example, and within the first 5 years of their registration. And the quote here is just from the Dean of the NIHR Academy about very much putting more effort into attracting and supporting underrepresented groups. And the reason why that's so important is that we know that the greater diversity that we have in our workforce pursuing research, we're going to be undertaking research that is going to be far more meaningful and impactful on the care and treatment and support that we're providing. Next slide, please. So the Insight programme for South London, so as Adele and I said at the beginning, we're the co-leads for this programme. And what you can see on this slide is the other organisations. So you can see the university, so that's us at King's, Adele at London South Bank, and then also colleagues from Kingston University and St George's. And then importantly, we also partner with our NHS Trust, and you can see those detailed on the right-hand side. So this includes NHS trusts in South London, for example, King's College Hospital, South London and Maudsley, St George's, but also those that are outside of South London. So, for example, Central London Community Healthcare encompasses right the way up to North London. The Royal National Orthopaedic Hospital is also in North London. So people are eligible to apply for our Insight South London scholarships if they are employed in any of those NHS trusts, or they're working in another NHS trust, for example, Oxley's or Lewisham and Greenwich Trust, which are both located in South London. And of course, colleagues who are working within social care settings in South London are also eligible to apply. Next slide, please. So this slide just gives an infographic, an overview of what the Insight South London programme is. So as I've said, you can see on the right our partners. You can see in the middle what our aim is: to deliver innovative and inclusive programme of research, engagement activities and research master's scholarships. And then what you can see on the bottom of that slide is what those scholarships are. So we are offering 90 master scholarships in total, which equates to 30 per year. So this year we're offering 30 scholarships, which provides funding for 19 courses across our 4 university partners. Next slide, please. So for information about the scholarships for Research Masters, please do have a look on our Insight web pages. So this QR code takes you to that web page. All the information that Adele and I are going to give now is also on our web page. So the information about eligibility criteria, the information about which master's programs are supported by the Insight bid, how you can find out more about each program and how you can apply. And also importantly, what the scholarship funds. So all of that information is also on our web pages. So please do have a look at that. This recording will also be provided on our website as well. Next slide, please. So first of all, just a little bit of information about the scholarship eligibility. So as I said at the beginning, the NIHR have been very clear that the purpose of this funding programme is to support people to pursue research earlier in their careers. So this means that it's open to students, so undergraduates in their final year, and also then professions registered in healthcare or social work or public health. So that means that you could be a student and you're undergraduate in your final year, which means that you would then be eligible to start this, if you were successful, a master's program in the academic year in September, October, or you might be a postgraduate student and you're also going to complete your studies this year. Or you are a professional with a registration within the last 5 years. And that registration period obviously excludes breaks. So breaks, for example, for maternity or paternity leave or extended periods of sickness. And that's important. The NIHR have been very clear that they are looking for individuals who will be eligible if they are in 5 years of their registration. And the registration needs to be with a recognised registratory regulatory body. So you can see here on the right-hand side who are the eligible regulatory bodies. So to be eligible, you also need to have either already been registered with one of these organisations, or you need to be pursuing your registration. So for example, if you are a student, you will be pursuing that registration once your award, for example, of being a qualified nurse or a midwife or physiotherapist has been awarded, and you are then able to be registered with your respective regulatory body. So again, this information is also all on our websites. And as I said, the region is South London. So you need to be employed with one of the eligible organisations in South London. So a public provider of healthcare services or in social care. So that public provider also includes hospices, and in social care also including, for example, nurses within nursing homes, individuals employed by a local authority. Next slide, please. So the scholarship funding includes two aspects to it. So it includes the tuition fees for the Research Master Programme. So that means that we will, if you are successful, that your fees for that Research Masters Programme is covered through your scholarship. Some universities, including King's, charge an administration fee for your application. So that will also be covered by the scholarship funding, as long as you have been awarded a scholarship before you apply for your master's program. And we'll talk a little bit more about the processes of applying. And then the second part that the scholarship funds is a stipend. So a stipend at the moment is just over 21,000 for us in London, because it includes a London allowance as well. And that stipend is paid on an annual or pro rata basis, depending if you're studying full-time or part-time. So most part-time courses are over 2 years, which would mean that that stipend would be paid 50% per year. Some courses are over 3 years, but majority of them are over 2, or you're studying full-time where the stipend is paid per annum. And that stipend, the intention of it is to support living expenses. So if you are studying in your own time, so for example, you're studying as a full-time student, or you're studying in your own time, so you might well work part-time, and on the days when you're not working, you're studying, that stipend is paid directly to you as the student. Or if you are working clinically or in practice, and you require release from your clinical employer, then that funding is paid directly to your employer as a contribution to your salary costs. So it doesn't cover anywhere near all of your salary costs, but it is a contribution. Next slide, please. So So these are the different courses that are offered. I was just going to pause there, Adele. Am I handing over to you now? No, not.
Well, I'm happy to go through the courses, or you can continue,
Yeah,
Catherine.
why don't you do that? Yeah, you
Okay.
do that. Yeah.
Thank you very much. Thank you, Catherine. We will come back to the funding a little bit further, but as Catherine has outlined, one of the elements of Insight is the master's courses. So I'm quickly going to go through the respective courses. Please note that all the information about the courses are on our website as well. So if I don't mention all the courses individually, you can go to the website, which you had the QR code for earlier, and you can see all the courses. So at King's College London, these are the courses. I'm not going to list each one individually. Please note, if you are interested in the course, please go and look at the course respective website. So for Insight has got two elements. We'll talk about that application again later, but very important to note that you have to apply for the course and you have to apply for the funding through us. So we provide the funding, but at the same time, you apply through the course. So a wide range of courses offered at King's College London, which you can see there. Please note these are the only courses offered at King's. So you might see another course that you're interested in, but if it's not listed on our website, then we do not provide funding for that particular course. The courses offered at London South Bank University, these 5 courses are listed out here, both across AHP and nursing. Please note, you will see throughout our course provision, often there's mention of a top-up or a dissertation only. So these are for master's level students that have potentially completed all their credits already and is now in their final year, and all they need funding for is the final dissertation model. Depending on the respective courses, again, these are offered through our Insight funding as well. So have a look at the different courses. Courses offered at St George University of London, the 2 courses listed there below. And then our final university part in Kingston University, the course listed there as well. As I've mentioned previously, have a look at the Insight website to see which courses are eligible for Insight funding. I'm now going to talk through the application process a little bit more in detail. So you will see the first part of the application is to apply for your scholarship. The deadline for the scholarship is the 30th of April 2025. Please note it's a 1 p.m. deadline on the day. This will allow you to go and have a look. The details of how to apply again is on our website. It is an electronic application which is managed through Qualtrics, so your data is secure in there. There is a Word template. So if you want to go and prepare your application in advance as a draft format, work through it, make sure you've got all the documentation together, all the elements, you can use the Word template to prepare your application. And when you are ready, then go onto the website and then cut and paste and submit your application. Please note that we will be asking your profession, your registration, or the registration that you're working towards. So the application form does distinguish between people that are currently students, as in undergraduate students, and those who are actually already within the workforce within their first 5 years as well. Very important to note, you will be required to submit evidence of your employment details and also a letter of support or employer support. If you are a student and you're not yet employed, of course, we recognize that you don't have a letter of support yet because you might only be employed within the next 6 months. So just make it very clear on your application at which stage you are. But those who are registered and are employed are required to submit the letter of support. Again, there's a template which you can use. Thank you. Next slide. Jana? Did the slide move on? I'm just checking. Can you see part 2?
Yes, we can see part 2.
Okay, great. Thank you very much. Okay, so the application of your master's course is the second part. So now you have applied for your studentship, and at the same time, you're going to be applying for your respective course. This is the QR link that I mentioned to all the courses that are listed on our website. So usually we're going to award the scholarships towards the end of May, you might have already applied for a course or decided you want to do a course respective or regardless of whether you get funding, but you will apply for your course at the same time or from when the course applications are available at the respective universities. The application for the course is direct with the university as per their application procedure. So you apply for the respective course with the university through their portal. In your personal statement, you can say that you've applied for NIHR Inside London funding. If you already know that you're going to or have been awarded, you can mention that there, or you can mention that you have applied for that. Please note that the processing fee, in some applications for universities, there's a processing fee. Please make clear in your application that the processing fee will be paid through the NIHR Inside South London scheme if you actually were successful in your application as well. So as we mentioned, there's the link to the respective courses. I'm going to click forward in the next slide, but please tell me if you don't see mode of study slide in front of you. So the different respective options of studying, and I'm going to just focus on option 1, 2, or 3. So you can either be a full-time student, and then you will get the stipend directly paid to you and your course fees will pay to the university. Or option 2, you are a part-time student and part-time in employment. So then you can have your stipend paid to you if you're studying in your part-time. But option 3 is if you part-time study and full-time employment, then your stipend is paid directly to your employer. So this slide just outlines the various scenarios in which you might be, option 1, 2, or 3 specifically. On the right-hand side in the table, it outlines the amount of hours, potentially your employment status, the cost or the amount for the stipend, and then how it's paid as well. And then also the conditions that you need to adhere to. So, of course, if employed, your employment conditions are very important that they are actually agreed with your employer as well. I'm moving on to the next slide, and this is, please note that this slide was prepared by one of our other Insight partners in England, and I think it's down there at the bottom, they actually listed that they have given an example. So to you to be aware, I'm not going to go through the fine detail in this, but this is something for you to go and look at and calculate. To be aware that if you are employed and you actually get a salary and you get an additional stipend, it might potentially change your tax bracket in which you are. So there are implications if you're getting additional funding on top of your actual existing salary. So please be aware if you are employed part-time and that you're going to get your stipend as well, what those applications actually mean for you. So the examples that they give above is about just showing your tax and pension contributions, how they might be influenced if you're in full-time employment and you still take the stipend, or monthly stipend salaries, how that might change for depending on whether you're part-time or full-time. So this slide, it's your own responsibility as an individual to ensure that you have looked into receiving a stipend and how that might affect your salary or the implications for your contributions in terms of tax. So that's just to make you aware of that. And then the information for your employers. Your employers must support your scholarship application. So especially if they are going to provide time release, it's really important that they are aware of your application and fully support it. If employed, you are required to complete the letter of employer support, and it is uploaded with your Insight application. The letter of support has to be signed by your line manager, or in some trusts, they actually require the research or education lead to submit a signature as well. So please make sure that when you check within your trust who is allowed to sign off your letter of support, and no applications will be considered without the complete letter of support. So that's just really important to note. Do not submit your application without that. So I think we're getting to the frequently asked questions for the Research Master Studentship. Catherine, I'm just quickly checking with you. We were going to do frequently asked questions at the end as well, but do you want me just to go through these before we get to the scholarly activities, or what did you want me to do?
You could do those now, I suppose,
Okay.
couldn't you? Yeah.
Okay, so I will just touch on these, and then we got some time at the end to go through more other frequently asked questions. So a lot of the questions we got asked is around professions, including clinical research practitioners. If they are working towards a registered award, they are eligible to apply for that as well. So just to be aware, are the dental professions eligible for Insight? So the dental care professionals, like dental nurses that are registered with GDC are eligible to apply. They either are working towards or hold a GDC registration, but not dentists. The dentists and medics fall under a different funding scheme. So just to be aware of that. For international applicants, is the period of employment from the date of registration in the UK or the original qualification in your home country? So the same criteria apply. It doesn't matter where you studied. You have to be within the 5 years of registration or 5 years of obtaining your graduate certificate. Is there an option for flexibility with the master's course entry requirements for applicants from underrepresented groups? So the NIHR do not specify academic entry requirements. The entry requirements for the respective courses are decided by the respective universities. All the universities as our partners are encouraged to use inclusive recruitment processes, and they do consider the potential barriers for different groups, particularly those with underrepresented within research. So that is a responsibility of all the higher education institutions that offer courses within Insight as well. Going to move on. So we've mentioned there the application deadline. We've provided you with the QR code again. And please, before you actually start your application, do make sure that you've read all the information available. The frequently asked questions from the webinar today will also be available for you to go on to and look at further. We thought we'd end just to show you what is actually happening. So as we mentioned, the Master Scholarships is one of the big parts, the 30 funded places this year. But if you're not ready for your Master's Scholarship yet or don't want to apply, there's a lot of activities happening within the umbrella of Insight that we are offering. And we would like to encourage you to engage and participate. These activities, or research engagement activities as we call, are open to anyone to participate in. So you are welcome to register. It doesn't matter what level of your course you're at or what level of your career you're at. They are there to help promote research and promote research careers. So I'd just like to make you aware of some of the ones that are happening soon and have just happened. So there's a very important Discover Research event. So anyone interested in a research career, this is happening on the 13th of March. And we will be sending out information on that, but it's on our website as well. And then just yesterday, the first podcast was recorded for, and this was managed, and the interviews took place with our student reference panel from Insight, who interviewed clinical academics in the workplace. So those will soon be freely available through YouTube and other networks for you to share and listen to, understand how people's academic or clinical academic careers have evolved, developed, and what were the facilitators and barriers in their own careers. We have a very interesting public and community event workshop that's on the 25th of March, and that's run by the South London and Maudsley NHS Trust. You're welcome to register for that event as well. And then there's often the Demystifying Research webinar series that's offered through our clinical academic training office at King's. So there's different events of those that you can actually watch online. And then, as I've mentioned before, something that we're particularly proud of is our student reference panel. I hope some of you are online. They have attended our student reference panel. We've just determined our own terms of reference. And the remit of the student reference panel is really to help us steer the Insight program to make sure that it's fit for purpose and meeting the target audience that we intend to reach. So moving to the last slide, which is just to talk or say that if you have any questions, please do use the Insight email address as listed on the screen to enable you to get in touch with Jana and Tina, who will then be able to direct your inquiry accordingly. So I think we can stop sharing at this point in time and maybe just go to the questions then. Catherine, I'm going to hand back to you. I think you wanted to do the first, is that correct?
Thank you. And then just to clarify, the application process is in 2 parts this time. We've got a little bit more opportunity. So what we're saying to people is to apply for your scholarship funding first. And then once as Adele said, you'll know the outcome of your application. We're planning to shortlist and complete that in May and tell people in May the outcome of their application. Once you know if you've been awarded a scholarship, is then to apply for your respective master's program, because you should then have time within the master's programs typically open in March. Most of them then close sort of end of July. So that gives you then time to apply directly to the respective university. But you do need to be in the application form. You will see it will ask you which master's program are you looking to apply to. So you do need to make sure that you have reviewed the respective program that you're interested in, that you have the eligibility for the research program that you want to pursue, that each university will detail on their website for every program that they offer. You can make informal inquiries about the course that you're interested in, but you might want to wait to apply until you know whether or not you've got a scholarship. And the reason for doing that is because, as I said, that the universities charge an administration fee for your application. So basically it means if you apply, you'll then might incur a cost of £75, for example, and then you're not successful in your scholarship application. That means that you're then out of pocket for £75. So you need to do the work in thinking through what research program, master's program you want to pursue, and you need to be preparing your application, but then you submit that once you know the outcome of your scholarship funding. And we've been able to just split it this year just because there's a little bit more time. Last year, we didn't have that luxury of time, and it had to be done in tandem to meet both the universities' window when they were open for applications and our window when we'd actually secured the funding. But all of that is detailed on our website as well. So I'll move on then to some questions. We've had some in the chat, so please do post your questions in the chat. And we'll certainly answer things now. We've got about 25 minutes to answer your questions and things, so we'll try and do as much as we can now. If we don't manage to answer all of them, we'll do that afterwards via email, as I said at the beginning. And also, if there are things that we don't have the answers to, we'll also say that, because some of the things we need to check back with the NIHR as our funder, or we need to just check back with the respective universities for a course that has been that people are interested in. So first of all, I just want to pick up on 2 really important questions that were posted when people were registering. So the first thing that people asked us is, what essential things are you looking for in a candidate? And that is a really smart question that I sort of think that next time we will add that on the webinar. So the things that we're looking for, so when you complete the application, you'll see that there's all the sort of information about what's your discipline, what regulatory body you registered with, when did you register, what's your registration number, or are you working towards it? And then we ask you 2 questions, one of which is about your research interests and activities to date. So what makes for the things that we're looking for is basically your potential. So what have you been doing up until now? So that might be research that you've been involved with. You might well have supported a research study that's, for example, been undertaken in your clinical area. It might be that you've been involved in audit or quality improvement work. It might be that you had an abstract that you've submitted for a conference that your NHS Trust was running, or it might be that you had opportunity to submit an abstract from your undergraduate dissertation, for example. But we want to have a sense that you are somebody who is interested in pursuing research within your career. So that's the first thing is, tell us about your potential. Tell us about why you're interested in research and what you've been doing up until now. And then the second thing we ask you about is what difference is it going to make for you if you are funded to be able to undertake a research master's? And in that bit, what we're looking for is for individuals to tell us, well, actually, this is going to enable me in my career to pursue my career in this way. And when we talk about pursuing a research career, we're very mindful that there are many different research career pathways that are open to individuals, both by your respective disciplines, also by where you're working, the setting, and also your own career aspirations. So it might be that you're looking to pursue a career in advanced clinical practice, for example, and you're very attentive to the research pillar as an advanced practitioner. You might be looking to pursue a career in research delivery, or you might be looking to pursue a career as a clinical academic, and the master's is going to enable you to then go on and pursue doctoral funding. You might be looking to pursue a career as an academic or as an educator. So that's what we want to know, is what difference will it make if the NIHR awards you this funding for you to study the respective master's course that you're seeking to attend. So Adele, shall I hand over to you? Was there anything else that you wanted to say to that one? And the next thing we were going to ask is, what are the career opportunities from obtaining a research master's? Was there anything else that you wanted to say about what we're looking for are essential things in a candidate?
No, thank you, Catherine. I think you have made that clear. I think you've touched on the next question as well in terms of the career opportunities or pathways that people want to take. So the question is, what are the career opportunities from obtaining a research master's award? And those are vast. It depends on what you want to do as an individual. Where do you see yourself in the future? So as Catherine has mentioned, there's different options. You can use your master's qualification towards becoming an advanced clinical practitioner. There is research delivery within the trust. There's different respective research posts, both within the NHS and private sector, if you were interested in that. You can go down the clinical academic pathway, where you are in a clinical work environment, but lead research within the NHS as well. Or you can have a research academic career where you teach, and as well as teaching, you also undertake research within your academic role. But it is important to recognize that a research career enables you to, or a master's qualification enables you to really strengthen your research expertise. It gives you knowledge and understanding so that you are able to not just be a consumer of research within practice, but that you actually also can inform other research that's taking place within the workplace that you are. If you are interested in any other NIHR funded opportunities, the NIHR have developed not just opportunities for people that have just qualified, but they're looking at early career individuals through the new internship schemes. There's advanced practice with doctoral routes. So please look at the NIHR website as they clearly articulate the different careers for nurses, midwives, allied health professionals, and other groups. So you're welcome to look at that website as well. Thank you, Catherine.
Okay, thank you. Very comprehensive answer, Adele. So we've designed the research programs that we have in offer to cover those breadth and diversity of careers that Adele has talked about. So there is quite a lot to choose from. There's 19 courses that we are currently supporting, which I'm aware can be quite confusing. So do take the time to think through what you want your future career to look like, and talk through with others, your line managers, your colleagues, your research leads, for example, within your different organisations. So I'm just going to pick up with some of the questions in the chat. So one of the ones that we are asked a lot about, so the questions that we received in advance, the questions that are coming up in the chat, is around the eligibility for length of time of registration. So this is a strict eligibility criteria. So the NIHR have been very clear that people need to be within 5 years of their registration. That obviously excludes where people have had maternity or paternity leave or long periods of sickness. And again, you'll see on the application form that we ask you for the year of registration and also your registration number, or that you detail that you're working towards registration because, for example, you are a third-year undergraduate student. We do check your registration status. And unfortunately, if you are beyond the 5 years of registration and you don't have periods of breaks, then you would not be eligible for this funding scheme, which I know is hugely disappointing. And we've had lots of conversations with the NIHR, and I think all 12 regional programme leads have pushed and argued that that registration criteria should be extended, because of course for many professions there is quite a period of preceptorship. Often people are not in a position to be pursuing research masters early in their careers. For some individuals, their employers are not able to support them, for example, until they're a band 6. So we're very aware of that. The NIHR have been very clear that there are other opportunities that Adele's talked about. So things like their pre-doctoral fellowships, so their PCAFs, is an example of other funding. Also of the internships, which is a program that Adele has been leading, which is now there'll be a new internship program that will be launched later in this year. So that's one of the main things that we're asked about. That also includes if you are an international colleague and, for example, your registration with, for example, the NMC is within the last 5 years. Again, we are asked to look at the year of registration in your respective country. But please do tell us if you have had breaks in service, so that that can be taken in account when we're looking at people's periods of registration. So other questions. Adele, did you have any other particular questions that you wanted to pick up on?
There was something interesting in the chat, and it comes up quite often, is saying, I'm not currently in South London, but I intend to move to South London. So our criteria is stipulating that you have to be employed in South London if you're not a student in South London. So if you're currently a student in South London and you're about to qualify towards the end of this academic year, then yes, you are eligible to submit your application. If you're not and you're registered and working elsewhere in the country, but you intend to live in South London or within one of our NHS trusts or partners, then you have to have evidence that you're actually going to be in South London. So it's we recognize that people do relocate. We don't want to reject applications, but any application or any outcome of an application will be subject to that condition. You will have to be employed within a South London trust or within our partners as outlined on our application form. So I know that is quite strict, but that's the NIHR funding criteria as well.
Okay, thank you.
Yeah, there was another interesting question around, sorry, I'm just quickly trying to find it, around the I think it was from Madeleine, who said, I'm in the final year of an MSc pre-registration course, but will only be qualified later in the year. Not yet employed and unlikely to be employed until the summer. So we recognize that as well. At that point, yes, you won't have employment details, so that you won't be able to state that on your application. So it will be as a student within South London that you are applying with the intent to then be employed. And as you say, you won't know what your stipend will be, whether you will be in full or part-time employment. The stipends only start to be paid from when the courses actually start, so there is a bit of leeway in that, but please meet the criteria of the location, as in South London, if you're a South London student, or a South London a geographical location in terms of your area of residence. And there was another one, Catherine, I'm just quickly going to that, was the international applicants again. Applicants are accepted in the scheme, but you do need to meet the university home fee criteria. So the Inside scheme only funds home fees for students. So if you do not meet the university home fee criteria, we are not able to fund you through the Inside scheme. I think that's what we did last year as well. So just to be aware of that. If you are unsure of what the home fee criteria is, please get in touch with the respective HEI to check that you meet the eligibility criteria for home fees if you were interested in a course. I think those were three of the common ones that come up often, Catherine.
Okay, thank you. And then the other, which you touched on, Adele, was if you're a student or if you are employed. And you'll see that when you complete the application form, that it asks you. So if it's you know, and it will say, are you currently a student? And you'll put yes, and then no, you're not then required to submit a letter of employer, because as it says in the chat, you don't have an employer at that point. But what happened with students last year was that for some of them, they then studied part-time and then secured employment part-time so that they could then study in their part-time. If you then secure a position once you've gained your qualification, if you are then employed full-time, you will then need to negotiate from the start with your employer that you have release to undertake your studies, your research masters. And in the Q&A on Teams, somebody asked about, can I work full-time and study part-time? And the answer to that really is no. So if you're working full time, you would need to be released. So on average, it's a release of 0.4 or 0.5 whole time equivalent, which is like 2 to 3 days a week. Obviously, that's not 52 weeks a year. It's in term time. But then in the holidays, you invariably have assignments and things to be doing. So no, we wouldn't be supportive of individuals who say, I'm working full time, but I want to be able to study part time as well, because that's not really going to be possible. There are not enough hours in the day, and you're not going to do justice to the opportunity of having funding to undertake a research master's program. So other questions, let me...
There was one around, again, an international applicant, and they have been an NMC registered nurse for 3 years in the UK, but an experienced nurse abroad for a number of years. So again, unfortunately, you do not meet the eligibility criteria because they count all your years of experience, whether it's NMC registered or having worked abroad. So you have to be within 5 years of completing your undergraduate training, please.
And then just in the Q&A, a very important question, does your current banding with the NHS, band 6 or a 7, for example, make a difference? And the answer to that is no. It's not about your banding, it's about your period from registration. And for many individuals, they might well have been at a band 6 or 7 by the time they've reached 4 years of registration. So yes, the eligibility is the period of time from registration as opposed to your current banding. What's important for us to see, as I said about, you know, what makes a good candidate, is the detail as to, what research things have you been up to, what difference will it make in your career if you then secure funding to undertake a research master's program. So probably particularly for individuals that are, for example, a band 7 in a more of a senior clinical role, that you're clearly demonstrating an interest in research within your clinical practice. And when we say that, we're very aware that people have very different opportunities to pursue research within their practice. So some of that exposure to research might be that you're keeping up to date with your professional journals, that you've taken opportunities to attend meetings that are particularly focused around your area of specialty. And also if you've been involved in things like, audit and QI, all of that is showing your interest in pursuing knowledge to improve the way that we're providing care, clinical care, and improving practice and treatment that's been delivered. So we do want to see that for you to tell us. And if you're a student, for you to tell us, what have you really enjoyed? My, undergraduate dissertation is focusing on this. The module that I was really inspired by was this module because, we want to have a sense of that you're excited by this opportunity, and that excitement means that it has the potential to make a difference for you in your careers.
There was one more question, Catherine, that I just picked up. Someone asked around whether you're doing another master's course, if that's considered part of a break in service. No, unfortunately, education is not considered break in service. When we particularly talked about potentially people being on maternity leave or paternity leave, but not having studied while working full-time or studied part-time while working full-time. That is not considered a break in service. Sorry.
Thank you. And then we've got another in the Q&A from Petra about, so this is again, which we tried to touch on about, what difference does it make to me if I hold a research master's? And Adele and I sort of outlined the different career pathways, but Petra, you're asking very specific things. Does that mean that I will automatically move a band higher? No, but what it does is it opens opportunities for you to be pursuing more senior clinical roles. For example, as a nurse specialist, there's a requirement for masters, certainly on the advanced clinical practitioner or advanced nurse practitioner, also that the individual has studied at master's level. And then secondly, if you already hold a master's degree, that's absolutely fine, because a lot of the master's degrees that people hold have been very clinically focused. So for example, it's been the MSc in advanced clinical practice, which emphasis is on clinical skills, so being an independent prescriber and advanced physical assessments, for example. But what this is enabling you to do is that you could go on, for example, and then study the research masters, so to do the MRes, whereby you were then really developing and pursuing your research skills. But what we would want to see in your application form is that you detail that to us. You tell us and you say, yes, I have a master's already, and you'll detail that on the application. But then you need to tell us what difference is it going to make if you're then funded to pursue a further master's program, like a research master's, or it's an MSc in clinical research delivery is one of the other courses that we also offer. So I hope that answers that question. But holding a research master's program, basically it opens more doors for you in your careers, and that's what's important. And the doors that open for you and the ones that you choose to go through will depend on what you want your career to look like. And for some individuals, they will want to go on and pursue doctoral funding. For other individuals, it's about going on and pursuing their advanced clinical roles, or as I said, it might be coming into clinical academic work or academia or education. So having a master's programs opens another door, enables you to continue along your career pathway. So we've just got a few minutes left, Adele. Are there any questions that we've missed that we should pick up on?
No, I think most of them are covered in the Q&A anyway on the website, so please have a look. I think the last one that came through was around the recording. So people that have registered for this webinar, we will send out an email with the recording, but the recording will be on the website as well. So please feel free to look for it on the website shortly as well. I don't know if there was anything else.
Oh, you've just asked us about the mental health MSc, and apologies, I hadn't realised that their master's programme there on their website, it closes in March. So I put in my response that we'll find that out. We can just follow up with the coordinator for that MSc programme as to whether or not they are actually closing all the applications in March or not. So we'll find that answer out, and then we can email that out within the frequently asked questions as to the response to that. So that's not a problem. So apologies. This is the challenge for us in having 19 different master's programs, that we just don't have the detailed information on all of them. Like that one in particular at the moment says that it closes, it's for applications at the end of March. So we will check that with them, and then we'll confirm whether or not they will accept applications from Insight scholarships beyond the March date. So yeah, we'll need to come back to you on that. Okay, any other questions? Yeah, Adele.
No, it was just a comment from Jo that she said, yes, she was confused with the event that we're having in March. Yes, Jo, there's lots of events taking place. Today's webinar was really to highlight the Master Scholarship, so hopefully we have addressed that. But please do have a look, everyone, on the website for information about all the other events that are offered within the umbrella of Insight, as I mentioned. So the big research event in March, and the public engagement workshops in March, and the podcast, which will soon be on there as well. So lots of events taking place. Yes, and just opportunities for you to be involved more than just doing a Master Scholarship. But today's webinar was about launching the Master Scholarships for this year. So we hope that we have addressed many of your questions, and hopefully, yes, do get in touch with the Insight team through the Insight website if there was anything else. But we will post frequently asked questions on our website as well. Thank you for your time today.
Brilliant, thank you. And I'm just going to do one final one. People asking, saying that they already hold a master's qualification. Are they eligible? The answer for that is that you need to tell us in your application why you're seeking funding for a further master's programme. And that really is going to be informing our decision making about whether or not we award funding. The other thing I would say, I can see one colleague's put in that they hold a master's in public health. Please do also be thinking about, if you're interested in pursuing research and you've got a master's in public health, it might well be that actually something like a PCAF might be better to support your transition, for example, to apply for doctoral funding. So please do also get in contact with us in the King's Clinical Academic Training Office, just to support and guide in the other funding opportunities for people to pursue research careers. And the other thing that we'll do when we do our frequently asked questions, that we'll put in that the links to the NIHR web pages. They have brilliant web pages that tell you, I'm in public health, I'm wanting to pursue a research career, as to how to do that. So we'll also follow up with those as well. So I'm aware now we're at 4 o'clock, so we better say thank you very much. Adele has given a lovely roundup. So I'm just going to say thank you. Please do contact us. Please do look on our website, and looking forward to receiving your applications. Thank you very much, everybody. Okay.
Thanks, everyone.
Take care.
Bye.
Bye. Bye.